Coronavirus disease 2019, COVID-19, is a contagious disease caused by a virus, the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The first known case was identified in Wuhan, China, in December 2019. The disease quickly spread worldwide, resulting in the COVID-19 pandemic. In this video, we will discuss about the important information regarding the coronavirus outbreak. 1. COVID-19, a numerical analysis. Data is provided by the CDC through a COVID data tracker that is updated each daily. The true numbers are harder to track because not everyone who contracts the virus is tested, and home test results aren't included in the CDC data. However, those numbers are based on modeling and might be updated with fresh data. Localized COVID-19 surges can differ. People can use the COVID-19 by county tool provided by the CDC to assess the amount of risk in their home county or the county to which they are traveling. 2. There are several ways the virus might propagate. The CDC states that COVID-19 is distributed primarily through 3 channels. 1. Being near an infected individual who is blowing tiny droplets and particles containing the virus, inhaling the air. 2. Having tiny specks and droplets settle in your mouth, nose, or eyes. 3. Using infected hands to make direct contact with the mouth, nose, or eyes. Additionally, droplets can land on objects, and humans may contract the virus by touching those objects. Though the CDC claims that this is not likely to be the primary method of COVID-19 transmission. Even if the infected person exhibits no symptoms, they can still transmit COVID-19 to others, according to the CDC. In general, the likelihood of COVID-19 dissemination increases with increased closeness and duration of engagement. Outdoor areas are less dangerous than those inside. 3. The virus keeps evolving. The virus has also caused waves in new varieties. The World Health Organization designated the variants Alpha, Beta, and Delta after the Greek alphabet. Over the past 2 years, these variants have increased incidence of illnesses ranging from mild to severe. Although Omicron subvariant BA.5 appeared to be less lethal than variants that came before it, they nonetheless had the potential to cause serious sickness and death in some people. The BQ.1 and BQ.1.1 subvariants are still being watched by experts. 4. Long COVID continues to be poorly understood. Long COVID, commonly referred to as post-COVID circumstances, is another difficulty. According to current estimates, 1 in 5 adults and kids, including healthy people who experienced only minor symptoms during their initial COVID-19 infection, suffer from long COVID, which is characterized by the recurrence of old symptoms or the development of new ones that last for weeks, months, or even years. These typically appear 4 or more weeks after the initial infection and can range from exhaustion and muscle pain to serious respiratory, digestive, and neurological symptoms in rare instances. They can also include autoimmune diseases and multisystem inflammatory syndrome in children, which causes swelling in various body systems. Why this happens is still a mystery to experts. Dedicated post-COVID condition clinics are striving to treat people with long COVID symptoms across the nation, even though there is still much to learn. 5. Vaccines are essential for preventing serious disease and inpatient stays. One of the most effective methods for preventing serious illness is vaccination. Immunity from the vaccines has waned over time, And as new variations appear, infection prevention has become more challenging. Given that recommendations on timing, dose, and number of vaccinations vary depending on characteristics including age and health status, each person should be able to select the vaccine and booster or boosters, if eligible, that is best for their situation. On shots.gov, you may get more details about where to receive COVID-19 vaccines and boosters. 6. There are precautions you can take to avoid getting sick. 1. When necessary, wear a mask. If you reside in an area with a high level of COVID-19 or in the indoor spaces of public transit or transportation hubs, you should wear a well-fitting mask inside in public if you are 2 years of age or older. If you are treating a COVID-19 patient or are ill, you should also wear a mask. If you or someone you spend time with is at increased risk, if you are pregnant, unvaccinated, using immunosuppressive medication, or if you are at elevated risk, consult your healthcare provider about the proper usage of a mask. On its website, the CDC offers recommendations for selecting a mask as well as a mask buying guide. 2. Keep your social distance. Do this indoors and in public while you are in close proximity to sick people, especially if you are at high risk for serious disease. Avoid crowded areas and spaces with poor ventilation. 3. Test yourself. There are several tests available, including tests that can be completed at home and tests that must be sent to a laboratory. If a test is positive, you should isolate yourself from other people and inform those who have had frequent contact with you. If you have been exposed to or sick, there is a CDC tool that can assist you in determining how long you should remain isolated. 7. Here is what you should do if you feel ill. Everyone should watch out for symptoms of COVID-19, whether or not they are fully vaccinated. Anyone who thinks they have been exposed should get tested and stay home and away from others. Symptoms can appear anywhere between 2 to 14 days after exposure. According to the CDC, symptoms may include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. You should call your medical provider for advice if you experience these symptoms, especially if you have been in close contact with a person known to have COVID-19 or live in an area with ongoing spread of the disease. 8. Know what resources and information are at your disposal. Because knowledge about the new virus is evolving rapidly, you can expect information and recommendations to change frequently. Threats like COVID-19 can lead to the circulation of misinformation, so it's important to trust information only from reputable health organizations and sources such as the CDC and the WHO.